Hello world, it's me, Dr. Keith, the VR Doctor, here today to speak to you on this MedLearn special event to talk about clinical virtual and augmented reality. And I'm delighted to be speaking to you today using this technology, speaking to you from within virtual reality to you over a web platform. And today we're talking about VR and AR in healthcare. What are VR and AR in healthcare? How might you use them? What are the difficulties? What are the challenges? How can we move forward in this? Well, these are some of the questions that I'm going to be answering for you over the next 10 minutes or so with the aid of this duck. But I'll come back to that in a minute. Let's start first of all with who I am. My name's Dr. Keith Grimes, and I'm a GP. I've been a GP in the NHS since 2000. And I still work in the NHS, but for the most part, I do much of my work these days as the Clinical Innovation Director at Babylon Health. But today I'm going to speak to you as the founder of VR Doctors. And VR Doctors is an online forum allowing doctors and patients and developers and academics and researchers to come together and talk about the amazing possibilities of clinical virtual and augmented reality. And if I do this editing right, you should have the details appearing just down here and be able to join us on that platform when you like. So all these opinions and statements are all based on myself and my experience of using virtual reality with actual patients. So without any further ado, let's go on and find a little bit more about what exactly is virtual reality. Well, in most talks, what will happen is people will start to give you some definitions, and this is actually quite useful. So we're going to start here with virtual reality. What is virtual reality? Well, virtual reality is a computer technology that uses software-generated realistic images, sounds, and other sensations to replicate a real environment or an imaginary setting. And it simulates that user's presence in that environment and to enable the user to interact with this space. So what does that mean? Well, right now, I'm wearing a VR headset on my head, and I'm surrounded in 360 degrees by this view. And if I grab my camera here and move it, you'll see that we've got this lovely 360 view around us. And this is a view of the Monterey Aquarium at sunset, a beautiful place we're giving you a talk from. And I can interact with it using my hands here and moving different objects about. So what is augmented reality? Well, augmented reality is a computer technology that superimposes software-generated images, sounds, and other sensations on a user's perception of the physical world, thus providing them with a composite experience. And then you have mixed reality. Now, mixed reality is when you get the perfect blending of these two. You get the merging of the physical and the virtual world to produce a new environment, one where physical and digital objects coexist and interact with each other in real time. So, everyone confused? Everyone not sure what's going on? Well, this is where the duck comes in. Now, why am I showing you this duck? I'll put it on the table just now. Now, this duck helps illustrate the difference between virtual, augmented, and mixed reality. How so? Well, I'm in virtual reality right now, and to me, this duck appears to be a solid object that I'm immersed with. If I hold it in front of me, it'll appear in front of me. If I put it down, up, move it around, I'm immersed in the same space, and I'm surrounded by this as well. So if you can see from this diagram in the background, virtual reality is very much immersing a person in a simulated environment with objects therein. So what about augmented reality? Well, in augmented reality, what would happen is it would be layered on top, a bit like a heads-up display. So I would see it flat and lying right on top of everything that I see in front of me, much as this diagram just here. It would be overlaid, like the heads-up display that you might find in some cars or in jet aircraft and the like. So what is mixed reality? Well, in mixed reality, I'll be able to see the real world around me, not this virtual world, and this digital object would interact with, say, this table. So if it sat on top of the table, you would see it, but then if it sat beside it or underneath it, it would disappear. And that would be mixed reality. And they form part of a spectrum of immersive experiences that use immersive technology. So but now, bye-bye duck, I'll put you aside. I'll move on to the next slide. So how can virtual reality, augmented reality, and mixed reality be used in healthcare? Now, I like to break it down into 5 possible ways in which it's used. I think immersive technologies can transform current treatment methodologies. They can make treatment more effective, more comfortable, more tolerable, allow people to use them in different ways. Or they can act as a form of treatment in and of themselves. They can heal as a therapy in themselves. They can help reveal disease by acting as a diagnostic platform, not only to allow you to visualize data in a new way, but also to help diagnose your actual movement through these virtual worlds. Immersive technology can help you better understand medicine by giving you an immersive experience which is much more memorable and allow you to practice things and rehearse them before they happen, but even understand things from a patient perspective. And then finally, you have the expansion. You have the ability to take a person's perspective and see what things are like from their point of view. Alternatively, this could expand a person's world. When illness stops them from traveling outside, it allows them to go to different places, like this aquarium, or rather this view of the beach. So let's start with the thing that I first came across, transformation. Now, I'm a geek and I'm a gamer, and I've been using virtual reality for a long time now to enjoy entertainment, movies, things like that. But I was also working in general practice with patients that had significant problems at the time. And one of the things that I found is that I had patients who had pain that was difficult to control, particularly those patients that came into my practice that required wound care. Now, we know from studies that virtual reality is very effective at reducing pain during wound care. In fact, the work of people like Hoffman back in 2000 with burns patients showed that the immersive virtual reality could be extremely effective at reducing pain and distress for these patients. But of course, virtual reality headsets used to be really expensive, but now no more. You can use your own phone you can use your mobile phone with a headset, you can use cheap standalone headsets, or even relatively accessible headsets like this, Oculus Rift. And it was in this situation that I actually had my Samsung Gear VR headset, my mobile phone, and I had a headset and I had it sitting on the side of my practice, and I met my first patient, a lady called Isabella. And Isabella was a lady who had just given birth, and she had a wound in her back that she needed to have packed daily. But she was also breastfeeding, so she couldn't take any painkillers. And this was making things really, really difficult for her. So the nurse sent her to me. And on that day, I realized that I had the technology and I had a patient who had a need, so we brought them together. And with some discussion and her consent and managing the risks that might have been involved in doing this, we helped alleviate her pain. And such was the significance of the pain reduction for this lady, as she was distracted while she was having her wound care taken care of, that I decided to talk about it. This transformation of a painful way of having care delivered led me to form VR Doctors, a platform where people could share their experiences. And since then, I've used it with over 100 patients of my own and also helped other patients. For example, a lady called Kay, who's based up in Scotland. And I had helped advise her, along with Helen Shaw from Samsung, about how to use the headsets to help alleviate some of her distress when she has a condition that means that she can't take standard painkillers. And it's been really effective for her too. And so using this, I've started to use different technologies, such as this. This is a game called Bear Blast, produced by Applied VR in the United States. And it seems like a simple game. But what happens when you're using this in virtual reality is that your focus is taken away from a painful stimulus towards what's happening here. In this case, you have a cannon on your head and you're knocking over teddy bears. Now, this may seem silly, but the immersion, the distraction, the taking of the spotlight of attention away from pain and putting it onto some other entertaining activity significantly reduces pain and significantly reduces distress. And since then, I've been using it for patients, not only this, but some of the standard stuff, such as a Netflix documentary or other games that they can play. And it's been incredible, and it's simple to do, and over the next few weeks, I'll be publishing some information on the vrdoctors.net website to help you investigate this yourself. So after transformation, what else have we got next? Well, I started talking about this, and I met this gentleman here. Oh, excuse me a second, technical glitch. Aha! We're back! This gentleman here, Mr. Sunil Budia. Now, he's a cardiothoracic surgeon, and he'd heard me speak about how I've been using virtual reality with my patients. And what was fascinating about this is that he is a cardiothoracic surgeon doing operations on people's heart and lungs. And when you have these operations, you end up in intensive care quite often. And for a lot of people who end up in intensive care, they have a period of post-operative delirium, confusion which can delay their recovery. Now, we know from previous studies that if you take a person physically into intensive care before they go there for the first time, you can reduce that delirium. And Mr. Boudier's idea was whether you could do a 360 video and simulate what it was like to go into this environment to help reduce post-operative delirium. And this is in the early stages of a study that we hope to do later on. So this is virtual reality as a specific treatment. It's its own form of therapy. But what else can it be used for? Excuse me as I lean forward. How about diagnosing things? This is a game called Sea Hero Quest, and it's available on your browser, but it's also available in virtual reality. So what do you do in this game? Well, it's a fun game where you follow maps and identify sea monsters, and then when you get there, you fire a flare back to let them know you've found them. But the interesting thing here is it's testing your ability to move in three-dimensional space. And this is absolutely crucial to understand how people understand their position in the world. And it's a proxy measure for cognitive function. The company that built this used this to understand what the location sense is for people of male and female gender of different ages around Europe. And from this, they can identify when a person's location senses are deteriorating, which we feel might be one of the early indicators of dementia. So in this way, having fun, crowdsourcing information, virtual reality can be used to test a person's location sense, their positional sense, and help maybe diagnose dementia earlier. So what else? Well, I mentioned understanding. Now, this is one of the common things when people think about virtual reality. They think about 360 videos, and right here is my friend, Mr. Shafi Ahmed, who did a world-first broadcast of 360 of an operation back in 2016. Now, as a medical student, much as I was, you spent all your time sitting at the back here, looking over people's shoulders, trying to work out what's going on. But with 360, you can be immersed right in the center of things. And you can watch not only this video just here, you can actually see the laparoscopic video, you can see what the anesthetist is up to, but you can see close up exactly what a specialist expert surgeon like Shafi might be up to. And this works on Google Cardboard, a very cheap platform that allows you to use your mobile phone to do this, thereby democratizing high-quality access to training. But you can move from this and use haptics, the ability to sense physically in virtual reality. And the thinking is that people learn much faster in this way, so you can develop skills much more quickly. But you don't have to follow someone like an expert surgeon like Shafi Ahmed. You can even see what it's like to have a condition like autism. And here we have a patient with autistic spectrum disorder. And this video, 360, produced by the Autistic Society, I believe it is, back in 2016, helps simulate what it's like to have that sensory overstimulation, which can be so distressing. So as you can see here, and if you listen, you can hear the augmented sounds of people walking around. Watch these balloons as they come past. You can hear the squeaking, you can see it all, it's all very distressing. And this helps you understand a little bit better what the life experience of a person with certain conditions might be. If I can show my desktop. So what happens if you bring these all together? Well, then you get something which I call the VR consultation, the ability to be able to consult with patients in immersive virtual reality. And here's me about a year ago in an earlier version of Facebook Spaces. That's how I used to look. This is how I look now, at least in virtual reality. And what happens here is you can see in the background, I have a very large screen over there, but in this case you could bring a patient in and look at a large X-ray. You can also use a pen device like this. If I bring this up, here's the pen, and you can draw. So if I just draw a picture here, it's a 360 object that I can actually take and move around. I'll just get rid of it just now. So it's an extra tool for helping patients understand things, but it's not only just flat images, it's 360 images, such as this, duck, or something maybe a little bit more useful, maybe a 3D model of a heart or something like that. And if you wait 1 second, one of my early attempts to do some 360 anatomy is coming up right now. The VR consultation, a fascinating way of interacting with patients going forward. So we've talked about virtual reality principally. What about mixed reality? Well, mixed reality is in its early days and using clinically, but already people are using it for education and training, as you can see with HoloLens here, putting 360 models in the real world. Or how about Google Glass? Google Glass overlaying information for people with autistic spectrum disorder to help them better understand the emotional responses and facial emotions of other people. And then down here, once again, we have Shafi Ahmed, this time using holoportation. These are people in different parts of the world, for example, London and Atlanta, appearing with him while he wears a HoloLens as if they're overlaid with him in the operating theatre. This is a fantastic opportunity for the future, for expertise to be brought in to the place that it's needed.
Hi, I'm Hitesh Patel.
So how are we using it just now? Well, I'm using it to reduce pain and anxiety for my patients. We've got chronic pain as well. People who have pain that's resistant to pain relief can use apps like this, Cool or Glow, by first-hand technology. And my friend Dr. Farhan Amin, who's working by using virtual reality to replicate what it's like to do physical therapy, for example, pulmonary rehabilitation, which can help bring the benefits of this to people with lung disease. So it's already possible to use this, not only with clinicians, but also for patients on their own. And that's it. A very brief trip through the possibilities of virtual reality. I'm really delighted to use this MedLearn platform, and I'd love to hear more from you. So if you have any questions, you can contact me through VR Doctors on Facebook. Again, the details should be along here. You can follow me on Twitter, at Keith Grimes or at the VR Doctor. And I've also got my website where I try and post all this information. I think using online fora like this to share information about novel technologies and help empower patients and connect them to clinicians and developers so they can better understand how to best deliver the benefits of these technologies is a wonderful way to go forward. So I want to thank the organizers of MedLearn, and I'd like to thank you for watching, and hopefully we'll catch you online again soon. So from me and my yellow duck, it's cheerio.